My name is Kristi Kleinschmit. I am, thank you, the Vice Chair of Education for the Department of Psychiatry and a Program Director. And super happy to be here with you guys this afternoon. Jen, you want to introduce yourself while I get my screen up?
Yep, I'm Jen O'Donoghue, so I'm a child and adolescent psychiatrist and our Associate Program Director for Child Fellowship and for the Triple Board program. And then I also do some teaching in Layers of Medicine.
Great.
And I feel like I might know a few of you from Relational Leadership. It's good to see some familiar faces.
Oh, sorry. Yeah.
Go ahead.
Is it projecting the presentation? Awesome. Wonderful. Well, okay, I guess, Jen, you can take it away.
Yeah, well, we're just really excited that you're all joining us this afternoon for our workshop about being a more equitable educator. Kristi mentioned a little bit about ourselves, but we're excited to work with you all this afternoon and happy that you made it here through some Zoom difficulties. So next slide, Kristi.
Yes.
And neither of us have any disclosures to make. Next slide, please. In terms of our objectives today, we're going to be, the content that we're going to be looking at is based off of materials from the MIT course, Becoming a More Equitable Educator. And we'll talk a little bit more in broad strokes about that course and give you a little more information if any of you are interested in kind of going deeper with some of the material that we're talking about today. There's different mindsets, educator mindsets within this framework. And the one that we're really going to focus on today is the aware versus avoidant mindset, and considering kind of how we can support ourselves in having some of these challenging conversations that are necessary to improve equity in education. So a lot of the workshop is going to be really interactive. We have a case scenario that we'd love for you to all really, think about how you might handle the situation. We'll give you some time for personal reflection, and then you'll have time to talk and kind of debrief in a small group, and then we'll come back to the large group. And then before we leave you, we want to have you think of some kind of steps of how to support yourselves in this very challenging work moving forward. So in terms of doing this work together, we know that we're going to be talking about some difficult topics, some challenging topics. We're also encouraging, all of you to be, open. We know in doing this work that we're going to make mistakes, that things won't always come out right. And that's part of kind of moving ourselves from the avoidant mindset to the aware mindset. So kind of knowing that, we'd love to kind of set a baseline of some psychological safety and some basic kind of principles of how we want to work together, knowing that some of you might know each other quite well, others of you might not know anybody else in this Zoom session. So we'd love to kind of set some norms for how we're going to work together, both in a large group setting, but also in the smaller group settings. And I'd love it if people, have any thoughts about how to kind of do this in a way that's going to feel safe and productive for those members. You can put any ideas about kind of ground rules or norms in the chat. You can unmute yourself and share whatever feels like most comfortable for you. Okay, Sheila, I love that. Yep, what's said in the group stays in that group. So confidentiality is really important, I think, for people to feel comfortable in sharing their experiences. And thank you for being brave, Sheila, and putting it out there.
It's respectful sincerity. I'm really glad that I'm able to participate, and I presented earlier, and it works so much better when people can really feel that what they say is okay, and it's an environment of appreciation, for what it takes to do that.
100%. I love that, respectful sincerity and environment of appreciation. Those are kind of new terms for me, but I think absolutely we want to have people, being authentic, being sincere, kind of being able to assume like the positive intent. I think that's part of, all viewpoints being welcome, so that nobody's going to be kind of shot down for wherever they're at in this moment. We want people to be able to be open and honest about that. And I just want to make sure I'm not missing what Sue is saying.
All viewpoints are welcome, and setting a brave space.
Yeah, I just heard that new term. I was at a diversity conference just last week or a few weeks ago. I thought that was just an interesting twist, but I'm still processing that. Safe, brave.
Yeah, I think it's interesting because some people feel like if we say, okay, we're creating a safe space, I think that you're right. We can't always guarantee the safety of others. And sometimes when we are entering into these challenging situations, we ourselves might not be safe because we feel safe because we're being vulnerable or we're being brave, but we're trying to get to that productive space that feels safe. So people aren't necessarily feeling threatened by others, or, obviously we don't want that, but we want people to feel able to be brave, to be vulnerable, so that things can be productive and there can be change. I like that. Yeah. Your mom's advice is great. Joanne, I really like that. Yes, say what you're thinking, try to be direct in your communication. Yes, I think that's super important, because otherwise, the more vague people are, the more assumptions others might make about what they're trying to say, and it just kind of leads to confusion. And I think in some of our scenario that will come up, that there isn't really that clear, transparent communication, and that can lead to a lot of challenges. Being okay with discomfort. Yep. When thinking through situations. Yeah. And having that kind of, we're all educators, we're all here to learn. So having that positive regard for each other, I think, is really important. You guys are already doing wonderful with this work. These are some of the session rules. So Kristi and I both kind of participated in a version of this with educators in psychiatry specifically, and these were kind of the session rules that we had come up with, and I think a lot of them have been mentioned, but that confidentiality piece is so important. Also, we want to kind of encourage people to action, so to take what they learned here and use it, again, not breaking anyone's confidentiality. I think a lot of people mentioned, to be open, to kind of assume that a positive intent. We're all here because we want to learn, we want to improve. So we need to be open ourselves, and we also really need to listen to what each other are saying and to their perspectives. And I think, of course, we're psychiatrists, so we're like, there's always going to be some judgment. We're humans, we know that. So just kind of be aware when you are maybe judging, and what that might be connected to in terms of your own bias, and also be aware when you're judging yourself, because we're also really critical of ourselves as well, and trying to kind of break down some of those barriers so that we can have that real transparent, clear communication. And I think we talked about that brave space, challenging yourself, also acknowledging when maybe something didn't come out the way I wanted it to. I can say, oops, that didn't sound right, or I can see from the faces of my small group that my intent is not the impact that had. Or we can also call that out in each other, like, that isn't quite landing right with me. I wonder, if we can explore that a little bit more. And then step up, step back. So just, if you are a person who's tends to participate a lot, it doesn't mean we don't want you to participate. We do, but in your small group, just making sure that everyone's kind of getting time to talk and discuss. And if you are a person that tends to hang back more, then encouraging yourself to be brave and to share your thoughts. So I think, as we mentioned, this is, we just want to give a little bit of context in terms of the MIT course that was created. So it was created in 2020. It's an online curriculum, and it was actually developed for K through 12 grade educators. And so since then, it's been adapted in different realms. As I mentioned, you've been adapted for psychiatry educators, but we're hoping that you'll all feel that it's relevant for all the different areas within the health sciences that you're educators. And I think Kristi and I definitely found, going through the material, that not only is it relevant for our learners, but it's also relevant for our patients. And to have these different mindsets can be really valuable when we're trying to conceptualize what might be happening with our patients, or what barriers they might be encountering. So hopefully it'll have that kind of dual benefit for you. But in general, the course talks about 4 different educator mindsets that can help us see bias and help us move towards equity. And so the one that we're going to really be focusing on today is the aware versus avoidant, which we'll get more into. But also, if any of you are all interested in participating in the online course, it's free and it's kind of open enrollment. But they do recommend that maybe having some colleagues do it with you, because I think that would lead to a more rich experience. So that's just one of the recommendations. And I think definitely Kristi and I both felt going through it with the cohort of psychiatry educators was very helpful.
And I attached this Mindsets for Equity that I actually have hanging in my office. I look at it often. It just is a good reminder for me to take these mindsets in mind when I'm thinking about my patients and my students that I'm working with. And we'll provide all of these resources for everyone. I think the slide deck will be provided, and we have content we'll upload. So the first part of this online, the MIT platform consists of actually an introductory video, which we think is quite relevant, and so we're going to watch it together now, and then we'll get to the rest of the discussion after that. Let me know if you can't hear it.
In U.S. schools, there's an overrepresentation of students of color in special education and an underrepresentation of students of color in gifted education. There is an epidemic of office referrals of African American students for disciplinary consequences. There is an overwhelming number of African American and Latinx American students expelled and suspended, and an underrepresentation of students of color in school-wide clubs and organizations and other prestigious areas like the school's homecoming court or student government. Race affects the operation of schools. And for every single student, racial identity shapes what they experience in the classroom. What we know from good science is that students' racial and ethnic identities are strongly linked to their performance. So in other words, if I feel strongly about my own racial and ethnic identity, I do better. The research doesn't suggest that if I hate people outside of my racial and ethnic identity, that I do better. But if I feel strongly about my own, then my performance is enhanced. So white students see themselves reflected in the curriculum, seeing themselves embodied in teachers, and they see themselves in language that's used in discourse or the jokes that are told. For Black students, Latinx students, for Indigenous students, their absence from the curriculum, the absence of teachers from their own background can profoundly shape their school experience. Race matters. But when you start talking about race and emotionally charged issues related to race, people may get offended. But it's so necessary. If you look at nearly every single indicator in education to do a deep analysis and to advance the work, you have to account for race as a factor or a variable. To make a comparison, imagine an oncologist and not studying an aspect of cancer because it doesn't make the oncologist feel good. It makes the oncologist, let's say, uneasy. Forget that. This work is raced. And if you're going to do work that is emancipatory, if you're going to do work that is transformative, if you're going to do work that engages and that meets the needs of every young person with whom you work, then you've got to consider race. Some educators may believe that because their schools are mostly or majority white, that these issues don't apply to them. However, aspects of race are still critical in majority white environments. It's particularly important to make sure non-majority students are still getting their educational needs considered. What's more, in the US, all students, particularly white students or students with privilege, are going to come of age in an increasingly diverse country. It's crucial that they have the skills to understand a variety of experiences so that they can communicate with, work with, and support their future colleagues and not reproduce racial structural inequities. We have to be able to talk about race and other taboo topics like gender and religion and sexuality, because we must be able to break through these taboo topics and speak explicitly about categories of identity and how they are impacting our children and our schools every day. If a system is not equipped to talk about identity and structural inequalities, it is at risk of reproducing them. On the other hand, when questions of demography and power become part of the conversation, they can become tools to talk about how well our systems are supporting the academic achievement of all students without accepting the failure or exclusion of any group. While some educators may worry that talking about race might get them labeled as racist, the truth is that our students need us to be able to talk about these real and pressing issues in their lives.
So, that was sort of geared towards K-12 students, but I think keeping in mind even just the backgrounds that all of our students come to us and all of our patients come to us with is tremendously important, and certainly has led to me wanting to do more work in this area. I have attached this framework to the chat, and this is the framework that we're going to be working from today. And I would encourage you to look at this and sort of your aware orientations versus your avoidant orientations as you're going through the case scenario that we have that people are going to go through on their own coming up next. So we have put together a scenario that we're going to attach into the chat. And what we really want you to do right now is open this scenario, and we're going to give you 10 minutes to go through this scenario on your own. There are text prompts, and I really would encourage you to commit to an answer. It doesn't have to be paragraphs long, but really think through the scenario and commit to your response to those prompts. Write it down, sort of, to incorporate into memory what you were thinking in that moment before you go on to the next page of the scenario, because it kind of builds upon itself. And then what we would ask you to do, we're not going to ask you to share your responses to this scenario specifically, and we're not going to collect them back. So you can really just reflect with yourself having this experience. And then you're going to use this scenario as a spearhead to our small group discussions that we're going to have after we come back together. So what I would love for people to do is to take yourself off of screen, go through this scenario, and then when you've gone through, please take your time. We have plenty of time. Then turn your screen back on.
It was a terrific document. Really liked it. Scenario.
Thank you. We're glad to hear that. We definitely had to rewrite it a few times, and I think Nina mentioned the typo of roles. So we were trying to make it. Obviously, we're all from different areas of the health sciences, so impossible to make it exactly relevant for everyone. But we wanted to try to make it as interdisciplinary as possible.
No, it's a great one. Was that part of the MIT, or that you created that one?
So we created that one based on the psychiatry specific one that we had when we did that version of the MIT course. And so then we tried to adapt it for this setting.
That's a wonderful sim environment example.
Thank you. Yeah, Jess?
I was just a little confused who the resident was. Was the resident a nutrition intern or the student doctor?
That was the intern. Sorry. Yes, that was a confusing bit. I apologize for that. Yes, it was because that role had changed many times. So that was the nutrition intern. Yeah.
Well, we are now going to have you all join breakout groups, and these groups are going to be self-facilitating. So we don't have plants in the groups. We really just want to encourage open dialogue, sort of going by the rules that we had already sort of set forth. And what we want you to do when you get to your room, introduce yourselves, kind of your education roles, and then what you're currently reading or watching, right? We got to find some commonalities and learn from each other what we can be doing to deal with our stress these days. And then these discussion points we will put in the chat as well, but really wanted you to answer these questions. So you don't even have to go into sort of what answers you committed on your worksheets, but just wanted you to think through the scenario in a more complex way. So I'm going to have you guys join your breakout rooms, and then please message me or Jen, or just if you're having issues or if things don't work right, or if you're having some discussion point questions, like we can pop into your room and help clarify things or answer questions or whatever. Okay. Questions right now? Anyone? Okay. I will open your rooms. Hopefully you're going.
Hi, everyone. Welcome back from your breakout rooms. It's always interesting to watch people come back. Nobody came back right away, so we're hoping that means that people had good discussions in their breakout sessions. But we'd kind of love to hear about any maybe themes that came up for people in their conversations, or take homes, or anything that anyone wants to share about their small group discussion.
It's either Joe or I.
Oh, I was going to actually ask if Allison, if you wanted to present. I know you're in the library, but I think you had like good observations and good thoughts. I was going to see if you wanted to present.
I'm a little distracted. I didn't hear the question because I am in the library, but if you repeat the question, I'm sure I could share some.
If you wanted to share any of the thoughts from our group that came up.
Yeah, it was super vague. Just any thoughts or take homes that themes that came up.
So I think we talked a good bit about how authority and how in different stages of a career or even training, like maybe a dietitian is a master's program, and maybe a doctor, has more years of schooling and more training that they have to go through. And so that definitely plays into how confident people are in conversating and discussing some of the issues that they may not bring up if they're afraid or they don't feel safe. And this especially plays in like when a trainee needs to talk to their mentor or somebody who may be writing a letter of recommendation for them, things like this, because they may not want to strain that relationship. And so that definitely was an interesting conversation to discuss. And we even talked about how even later in your career, you still can't just say anything to your boss or people who are above you. And so that was definitely interesting as well. I think that was the main takeaway that I got.
Yeah, those power dynamics cannot be underestimated in terms of people's ability to kind of give important, feedback or speak their minds, for sure. I think to me, we obviously, this is a little bit of an artificial setting, and we know we're all educators and we can, feel maybe more comfortable with each other. But to me, it was clear on that team, there was not a lot of psychological safety, right? People felt very uncomfortable, but did not feel comfortable to like speak up or address the issue more directly. Any other thoughts that people had? So power differential can be a huge barrier to these conversations. Other barriers that came up for people?
I was going to mention something different, not about barriers, but we talked about the importance of lending the benefit of the doubt, kind of like we talked about in this discussion. Like, we don't know for sure what happened among the initial dietitian and the patient, and that the important thing is to make sure that the patient gets good care and understands what he needs to eat, and then that the dietitian understands, is educated about different communities, and that the setting in which everybody, and even the doctor Dr. A, who appears to have some blind spots, that the best way to kind of get everybody on board and moving in the right direction is to give some benefit of the doubt and not make up stories that someone's a racist or,
Right. And to some extent, right, the absence of a dialogue, it creates more of those stories and more of those assumptions. So yeah, giving people the benefit of the doubt can mean having those challenging conversations so that there
I
is.
was really surprised nobody asked, like, well, what happened in the initial? I mean, maybe there wouldn't be a case study if we knew that, but it's like, why is nobody asking what happened?
Yeah,
How are we ever going to get to the bottom of it if we don't know?
right.
Well, it's so funny though. It's funny. I didn't think that at all, only because the first question is like, well, what did you think about their experience? I was like, oh, I've heard that from patients all the time. So like, I'm actually not surprised at all about, like, it just didn't even occur to me to doubt that, because patients, I hear that about them from race. I hear that about them because they're obese, like whatever it is, they come in and it's not just with nutrition, right? It's like whoever they talk to, they're like, well, so-and-so just assumed that all I do is drink soda. So-and-so just, and so that's funny. I appreciate Kimberly, that thing, but I was just laughing because I'm like, oh yeah, it didn't even occur to me, because like, this is just what my patients say every day, is that people make assumptions about them.
I think, Kimberly, what you raised about what happened, and it brings up the elephant in the room is the unspoken voice. It's that empty space, and what's missing is the patient's voice, because the two doctors didn't talk and didn't create a space where others could talk or even explore their own implicit bias. That empty space reflects the patient and perhaps students who were unable and uncomfortable to speak, to their supervisors. And we're subject to our own fears and the barriers of raising our hands and speaking out. And as much as we all care about students and patients, and however this applies to your career, the people with the least voice are the ones that are most harmed by our silence. Their voice isn't even there.
I really appreciate you, raising that, Sheila. And I think totally we can see that shifted so quickly. Like, he was presenting the patient, it was patient centered, and all of a sudden the patient left. There was no patient. It was about, the attending physician's assumptions about whatever happened to the patient. And so even just feedback for that attending is like, let's keep it patient centered. Let's not lose track of, the focus here. And I think that a lot of other good conversations would flow from that. I'm cognizant of our time because I know we got started a little bit late with technical issues. So I really appreciate it. And again, I hope you all had some valuable conversations in your small groups, and feel free to write things in the chat if there's other things that you want to share as we kind of move on to the next phase.
We're here. So the next step of this, right, is just we're going to hear from some more of the educators, but really allowing ourselves to find opportunities to talk and listen about identity. And I think the listening piece really came through in that case scenario, right? Like, the supervising dietitian really did like put that inroad to open the discussion, and the attending, I think missed that opportunity to listen and pay attention to what was going on, and sort of quickly moved with their avoidance to just kind of get off the subject. So let's see if we can get this one to play. This one's shorter.
Aspects of our identities as teachers and students affect the operation of schools. In America, race plays a central role in how people experience school and what opportunities they're afforded. In the US and in other countries around the world, gender, disability, sexual orientation, religion, all these things may play similar roles. Since these issues affect our world, since they affect teaching and learning, educators have to be able to talk about them. Talking about taboo topics is hard. Here are a few key pieces of advice that we've gleaned about starting your own courageous conversations. First, find a partner or ally in this work. Sparking change is hard, but it's easier to do with someone to bounce ideas off of, to practice sharing your thinking, or to debrief and reflect with after you've had a hard conversation. Find an ally. Second, be prepared to make mistakes. Talking about race and other potentially taboo issues is hard, and you'll make mistakes. But the only way we get better at hard things is through persevering. I'll share with you some hard feedback that I got this semester. I teach a class at MIT on education technology, and we often discuss issues of race in class because those features of identity affect who gets access to technology and how it gets used. Every year, I have a few students tell me that wrestling with these issues of equity is really powerful for them. But this year, I got this tough feedback in my course evaluations. The teacher, that's me, should talk about inequity in a way that helps us understand it and empowers us to confront it. Saying things don't usually work for poor schools that are overwhelmingly Black and Hispanic and leaving the conversation there is a problem, and it made me feel uncomfortable. Equity should continue to be a part of the conversation, but someone who is trained in anti-racism should cover that topic. Oof. When I first read that, I had all kinds of defensive mechanisms. Oh, this student misunderstood. I didn't actually teach things that way. There are all these other students who did tell me that this part of the course was really powerful for them. I'm not just trained in anti-racism. I'm teaching a whole class on it. But that's not the point. The point is, I didn't get it right for that student and maybe for other students. My job is to remember that the work of becoming a more equitable educator is lifelong. It's about gathering feedback and getting better. I can't shy away from conversations about race in my education technology course because it's essential to understanding the topic. But I do need to be constantly trying to gather feedback, listen to students, find ways of engaging them that are challenging, but provide the support so that students can meet those challenges. That's a good lead into my third suggestion. Talking about race and other taboo issues involves really listening to students, colleagues, parents, and families. As you're getting ready to engage in more conversations about race and identity topics, it's natural to think about what you want to say. But it's just as important to think about how you want to listen. A crucial part of good conversations is really listening, not so that you can figure out how to respond to other people, but so you can understand what people are saying and trying to communicate. As you prepare to bring conversations about identity into your curriculum or into your staff meetings, plan for what you want to say, but really also plan for how you want to listen.
So I know we're at our official time, but I did want to just allow us just a few. If you have things to get to, go ahead. But I think we can wrap this up in the next couple of minutes. But I think this hopefully has opened some ways to think about how you educate and sort of the framework for approaching education as an equitable educator. And what we want you to really think about right now, and certainly you can share if you want to in the chat or vocally, but think about have you had some missed opportunities to listen, right? If you think back, I mean, gosh, I've had a ton during my career, right? I think especially when I was a young attending, I think often I'd be anxious enough, trying to lead a round and tend to okay, what's my treatment plan going to be and how am I going to teach all these learners, that I think you get so caught up right into what your message wants to be that you really do miss those opportunities to step back and pay attention to what's going on in the room and listen to what the themes are that are coming out with your students. And so I really want people to think about reflect on the missed opportunities and make an intention to not miss those again, or at least pick up on the next one, right? We're certainly all going to miss sometimes, or sometimes the timing is not going to be exactly right. But I think then setting the intention to revisit the topic because you heard, right? I listened and we're going to talk about this at this future date or during this time, and then following through on that. I also want everyone to think about who could be an ally in this work, right? Because it is hard. And I think, there are going to be conversations that don't go well. And it's just, things are going to come up. You're going to get feedback that doesn't seem to fit right. And so I think really, having an ally to process those conversations with afterwards is really important. Sheila, did you raise your hand again? Oh, okay. I saw it was raised. So I think, think within your school or within this lovely Academy of Health Sciences educators, right? Can you find some allies to continue to do this work and process going through this? And then making an intention of how to continue this work in your setting as well. We'll have thoughts or have gotten really good at identifying allies and found opportunities that they used to not take advantage of. I'd have to say it's been really nice to have kind of this national organization that we're part of, making this a priority and doing these teachings because, it's been really great opportunity to network with other colleagues across the country, and also to, you know, debrief even outside of your institution, which is sometimes really helpful. Well, thank you all for being courageous today and joining us on this journey. I really appreciate everyone's attention and your participation, and I think your thoughtful rules for the session were terrific, and I'm gonna certainly adopt some of those phrases because I loved them. I am gonna save the chat, and so we can share some of the rules for having these conversations, and then these materials will be available for everyone through the AHSC materials.
Thank you all. And yes, please reach out to us with any questions or if you need an ally or support in starting these conversations.
Or if we want to try to do, I mean, this is, you know, one of 5 modules. And so, I think there would be opportunity for even small group, like to go through and do all 5 of them within maybe cross-disciplinary learning groups.
Terrific. Thank you both for bringing this to us.
Yeah, I would encourage you to go to the MIT site. It's really great. It's a really nice resource. So,
So
right. Have a great day, everybody. Thanks so much.